We are live. This is Summer Spotlights with Rise with Hope. I'm your host, Aisha Nixon. Summer Spotlights is a series of conversations. Ladies, these are conversations to leave you inspired, enlightened, and empowered. These conversations are every Thursday evening, 8 to 8:30 p.m. Eastern Standard Time. Ladies, it's time to get comfortable, maybe grab a cup of tea because we are in for a treat. Our fourth guest today is Michelle Francis Smith. She's a registered massage therapist who specializes in perinatal massage therapy. So, ladies, I'm going to give you about 30 seconds because you want to be here for this conversation. So, Michelle, in just about 5 seconds, I want you to tell us who you are because this is the first time these ladies are meeting you, and I want them to know who Michelle Francis Smith is. I welcome you. I am honored and privileged to have you on Summer Spotlights. So let's get this conversation started. Welcome, Michelle.
Thank you so much, Aisha. What a warm welcome. I'm so happy to be here. Thank you for having me on as a guest. I'm also honored to be here, always honored to be able to be with women, to speak with women, and to empower, inspire, and educate women. That's actually a big part of what I do. So, who am I? Um, who's behind the name? I'm a mother of three. I'm a registered massage therapist of 20 years. I'm an educator. I'm a professor in the massage therapy field. I'm a doula, so I support women and families during birth. And actually, my massage therapy practice is very focused on perinatal massage therapy. So, all the types of massage that can support you during your pregnancy, during your delivery, and then during your beyond. So, into the postpartum phase. I do massage for infants and children. I have a special place for mamas who are carrying babies who have maybe some sort of diagnosis. So they're having a higher risk pregnancy or they're having a baby that they know may be special needs. So I focus part of my practice on doing massage on those little ones and helping parents connect and bond with their special little ones. So that's a little bit about me.
That is awesome. That is awesome. It's great to know, as you said, you know, who is behind the name, and who you are about. And so that's great. So, ladies, you found out a bit more about who Michelle Francis Smith is. And so we are going to continue to dive into our conversation. So, you mentioned you're in the field of massage therapy, more specifically perinatal massage therapy.
Mhm.
So, the field that you're in, tell us the change that you want to make in this field, Michelle.
Yeah. So, one of the things I think for the world of pregnancy is that people often take it for granted that because, you know, being pregnant or having children or having family is something that is common. And again, not common for everybody because sometimes people struggle with that. But it's a commonly occurring thing all around the world that babies are born. With that has come this myth or a bit of taking for granted the complexities of pregnancy in a woman's life, in her family's life, especially a working mama's life, and the stresses, the demands, and the impacts, even of a joyful, planned, expected birth, can be quite stressful. So, with massage therapy, while massage therapy helps everyone, like just basic massage therapy can help everyone with stress and physical pain and aches and pains and that kind of thing, what I focus on and the difference that I make with what I do is I create sacred space for women who are carrying, no matter what their circumstances are of their pregnancy, and I create a space where they can heal, where they can be connected to themselves and their baby, where they can rest and recuperate, recharge, where they can just take a break and be in a space that's medical, but it's not sterile, right? Because there's so many appointments that they're going to, measuring of the baby, making sure things are quote unquote normal, healthy. And there's not a lot of nurturing touch. There's not a lot of calm spaces that are about thriving in the pregnancy. It's all about like surviving. And that creates a lot of stress
Yeah,
and
absolutely.
can be very damaging to the pregnancy, but also just
Mhm.
affect the quality of the pregnancy. So the difference that I make is that I don't just massage you in certain positions, mindful of certain rules because you're pregnant. I create an experience for you to be really present in your pregnancy, which could be a once in a lifetime experience. Um, Let you be present in the pregnancy and connected to your little one, because that connection starts right from the beginning. And why not make it a powerful and beautiful one?
That is awesome. I like when you're talking about the change you want to make in terms of it, one, not being sterile, because
Mm.
as being as ladies who are pregnant, they go to a lot of appointments, and it could just be, you're in, you're out, but you want to enjoy the journey. And so it's great what you're doing and being able to help the women even while they're pregnant to enjoy the journey
Yeah,
and to understand, right, what
yeah,
they are going through with the use of massage therapy.
absolutely. Yeah.
That's good. What is maybe one of a piece of feedback that you've received from a woman who has experienced perinatal massage therapy?
Mhm. One of the more common things that I hear, and I'm so fortunate because I have amazing patients who come back to me pregnancy after pregnancy. They send their friends, they send their family members. People travel. I'm in Durham, Ontario. People travel from across the city outside of this region to come and see me. And one of the things that comes up often is just feeling of being cared for. Like when they come into my space, they've described it as like they get to take off all of their hats.
Mm,
They get to be unveiled and accepted. They get to be real. They get to be their authentic selves. They get to express emotions. You're at home with your partner, your family members. Maybe you're dealing with a lot, and you're emotional in a way that you're worried that the people who love you, if they see that, they're worried that there's something wrong. But really, it's just you needing to express, release. So just that I create a space where they can be themselves, where they can be present, for themselves, and that I just take care of them. They just sometimes just say, "Oh my gosh, I feel so cared for," which, I don't know if when I got into massage, I thought that that was the feedback I was going to be seeking, but it has been the feedback that is actually more valuable than anything else. People need to be cared for.
absolutely. And ladies, I hope you hear that, what Michelle is saying, a very important message inside and outside of massage therapy. We need to be cared for,
Yes.
and whether it's somebody caring for you and or you caring for yourself, self-care. But as Michelle has said just now, we need to be cared for. It's important. It's important. And I think a lot of times, in terms of ladies who are carrying, maybe the emphasis is put on the baby, and sometimes maybe the mom is like,
Secondary,
yeah,
like not
secondary.
really a part of it. It's like, is the baby healthy? Is the
Yeah,
baby okay? Is it a boy? Is it a girl? There's all this focus on that, and
yes,
not like, how are you?
exactly.
How are you feeling?
Yeah,
Especially not just in pregnancy, because I work with you through the whole perinatal cycle.
yeah,
I focus especially, even maybe even more so, in the postpartum period, where there is the potential for postpartum depression
yeah,
or postpartum psychosis, which often women are not really prepared for. They hear this thing called baby blues. You might cry a lot. It can go much more extreme than that. And it can get quite serious. And if you're not being monitored by healthcare professionals or family members who feel empowered to sort of step in on your behalf and advocate for you, it can be a really difficult thing. I've seen it, and sadly experienced loss of a previous patient due to postpartum depression extreme during the pandemic.
Mhm.
So during this time, especially, the difference that I've really wanted to make was I could have chosen not to continue working during this COVID-19 outbreak.
Mhm.
But once we reopened for people like myself, regulated health professionals, to return in June of last year, oh, my apologies. That's
That's
my email. I'm going to just make sure that's closed. Once we were able to return, I made sure to go right back into working,
mhm.
to do all the protocols. We increased all of our sanitation. We increased all the things that we could have control over, screen all of our patients, all of the things that you can do. And I made sure I was available because I felt the pain of my clients who were having babies for the first time with very little support in a system that was overtaxed by COVID-19, the mamas who had already given birth, and now all the social groups that used to exist where you could be with other mamas and their babies wasn't a thing. You couldn't be with people, you couldn't be with your family members. You had a team of people who were going to help cook meals and take care of you, make sure you were cared for. No one can come in the house. It's just you. Your partner's
Mhm.
going out to work, so you're alone with baby, underslept, overstressed. So I chose to get back to work sooner than maybe I would have if it was a different time, more out of the service aspect of it than out of the employment side of it.
That's great. That's good to hear. And so, ladies who are listening, if you have just had a baby and you feel some of the ways that Michelle has mentioned, at the end, she'll be sharing how you can connect with her. So, stay tuned to hear that in case you're wondering how and you're interested in connecting with Michelle. Um, if someone is interested to get into this field because they're liking what you're saying and they're like, you know what, I want to do what she's doing. I'm interested in massage therapy, maybe perinatal massage therapy.
Mm.
What are 2 to 3 pieces of advice that you can give to these ladies so that they can grab hold of it and
Yeah,
start making those steps?
I'm so happy to share this. So the first number one thing is you need to become a registered massage therapist or a massage therapist. It depends on where you are in the world that you're watching this. You might have to be a licensed, regulated, registered, or just a massage therapist. To do that, you need to find out in your local region what school you'd need to attend and what licensing, diploma, certifications you would need. So I suggest researching and then picking a school. Then you're going to jump right in and get ready for the ride of your life. You'll learn so much about yourself, your health, and the impact you can have in the world. That's what I learned 20 years ago when I entered this profession. So first you get a school. Once you become registered, licensed, whatnot, then you're going to connect with myself. Perinatal Massage Therapy Education is a business that I started with partner Nicole Alfred. We did this because we are both very focused practitioners in this area, and there's such a wide range of how we're taught, especially in Canada, between the provinces, even in Ontario, between schools. Some students learn like weeks of education on this, and some learn a half a day and never
Wow.
touch a pregnant patient in school, but then are expected to know how to do that when they go out.
Mhm.
So, what you do is connect with us in our community, and you can access our training. We have training that's completely online. Do it yourself at your own pace. We pivoted with COVID to make it accessible so that people didn't have to stop providing care because they couldn't get access to skills, advanced skills, and tools. And then being around like minded therapists. So we have a group on Facebook called the Pregnancy Massage Therapist Canada. Pregnancy Massage Therapist Canada. It's now expanded. There's people from the States in this group, there's people from Australia in this group. We're more than 2,000 strong in this group.
Wow.
And all the topics we talk about are perinatal focused. It's a free group, and it's just a place where you can kind of get a taste of what you don't know that you don't know. When you speak or you see a post and you're like, oh, that's what that was when I saw that patient. I didn't have experience with that. Or you just want to engage in conversation with other colleagues, especially around the world. So it's support, it's, of course, education as the foundation, and then it's advancing your education because you don't get to be where I am and my business partner are with only the education you receive in school. You get the basics in most schools, hopefully, and then it takes time and practice and experience. So we tried to fast track that, create a package of information, a body of knowledge, so that you could jump right in and start treating your pregnant clients and understanding the world of the perinatal world, even outside in other professions, midwives, doulas, obstetricians, lactation consultants. There's so speech and therapy. There's so many areas that kind of overlap within this area. So we really want you to be well equipped.
That is great. So, ladies, I hope you heard the journey that you can take if you are interested in massage therapy, specializing in perinatal massage therapy, and realizing that it like a spider web, there's other areas that you can connect with this being the hub, right?
That's right. That's right.
That's good. And what I saw on your website, I just want to read. It says you said, "I still have the passion to learn all the new and exciting practices that are continually developed in the massage therapy community, and
Mhm.
have the unrelenting desire to teach it." And what I like about that is that, as you said, education doesn't stop. Can
No.
you just encourage the women who are listening, Michelle, in terms of ongoing education?
Yeah, no matter where you're at. I was having this conversation yesterday with colleagues in the prairies. We do some education of therapists all over. And we were just saying that we still take courses, like during the pandemic, at the beginning of the pandemic, I enrolled in a coaching course. I was learning some things about how to get my message out. I picked up journals. I did some free courses on Coursera, which is a great website where you can take free training on different things. I, during the pandemic, became a certified lactation support person, community support person. So I'm not a lactation consultant. I
Mhm.
didn't do enough training for that, but I got some basics on how to support someone who is trying to breastfeed on some of the basic mistakes that they could be making that I could just, because they're in front of me anyways, they're there with their babies half the time getting massage and often are nursing. So to be able to provide that support or give them referral, I have not stopped. Like when March of 2020 came and the world stopped, I stopped being hands-on with people, but I started doing online massage, if believe it or not. So taking people through self-massage of the face, breathing exercises, stretching, other aspects of what it is to be a massage therapist that's in my scope of practice. I started doing that. It's really an amazing thing that learning keeps you alive.
Yes. Yes.
It keeps you in motion. So even though it felt like this world, the pain of the world stopping like that and losing lives and the fear,
Mhm.
I didn't let it immobilize myself because it couldn't stop my mind from growth, my spirit from growth. I
Mhm.
still felt inspired and I kept going. And so when the door started to open a little bit, I was able to share that with people and then it inspired them. So important. Like education is everything.
I love that. Wow, you said a lot of great nuggets there. And one that you said is learning keeps you in motion. And so, ladies, if you are thinking about, should I take this course? Should I, as Michelle was saying, there's some that are free, some that you may have to pay for, etc. um, I challenge you to whatever field of work you're in or business to take that next step and do some learning, you know? Yeah, because it helps us to grow and to grow more. We don't know everything where we are at, and we can always grow to the next level.
That's right.
Yeah, and so in what you do as a massage therapist, I'm sure you've come across some challenges. And
Mhm.
so, what are a couple of challenges that you may have come across, and how did you overcome them?
Mhm. So I love that question. I have to tell you that my day to day working in the field that I do, a chosen field where I get to make my own hours, see the specialized group of women and children that I want to see, it's like work that's no work. So I'm really very blessed that I had a calling and I followed that calling. But when I think about what was most challenging, it probably would have been in my early career, like the first 5 years, when I knew I wanted to focus in this area of pregnancy. And you'd have a pregnant patient come in and you would hear them use language that they had heard from, let's say, their doctor or another health professional that didn't validate massage therapy as being an option to support their perinatal care. They didn't know much about massage therapy in this way. They sort of saw it as, well, yeah, you can go for a massage, but it's not going to necessarily help you with your hip pain or your low back pain or your migraines or your this or that. Yet it does. It's not necessarily going to help you prepare for birth. Well, absolutely. Working on those inner thigh muscles, working on the hip flexors and the lower back, and breathing exercise, working through your ribs and your abdomen, that all helps you with labor, breathing, positioning. So I think my biggest challenge there was just not feeling that I was being validated as having a place, an equal place in the medical field
Mm-hmm.
as a regulated health professional.
Mm-hmm.
Like the regulating board that I'm under is the same as a doctor, a dentist, a nurse, a surgeon. Yet there's a hierarchy. So I struggled with that in the beginning because I thought I have so much to offer and these women are feeling better and they're having successful pregnancies and births. But that all changed. As the world learns, as people become more educated, and often health professionals become educated by their patients.
Yeah.
They come in and say, I saw this person for this and it really helped. And then the doctor or whoever is like, how did it help? Then they start to do their own research and realize, oh my gosh, there's this whole other thing that I didn't know was there.
Yeah.
This has been a thing of the past for a long time. I have not gotten any of that feedback. As a matter of fact, I have obstetricians and doctors who send me patients. You should see
Awesome.
Michelle. For this, you should see Michelle. Midwives who do the same thing, pelvic physiotherapists, chiropractors, counselors. I have psychotherapists who send me patients for
Awesome.
massage. So it's changed. It's such a beautiful thing to see how people understanding the value of
Mm-hmm.
nurturing touch, the value of skillful nurturing touch in the
Mm-hmm.
lives of women having babies and having families.
That is good to hear. And so, as they change in terms of being more educated,
Mm.
what did you do in the process while their thinking was like that? What was it? What strategy did you use
Yeah.
to try to overcome that? You know?
So what I really did is I stopped looking for the validation to share my message. I shared my message despite that invalidating thing. So I became more of an advocate.
Mm.
I became more vocal. When I started 20 years ago, social media wasn't a thing, right? So this kind of thing wasn't what I would do. But where my voice would be heard is with each one of my clients where my voice would be heard in a clinic with other disciplines where I would talk about what I'm doing and the results I'm getting. And then it would be in the classroom because I've been an educator for as long as I've been an RMT. So, anytime I was with students or colleagues, this is what I talk about. I worked in the hospital teaching students how to work with high risk pregnant women in the hospitals at Women's College Hospital, that's now changed, and at Sunnybrook Hospital. So even being a presence there, the nurses and doctors, like they know in those two hospitals, at least, that those doctors know what we do. They know the value of what we do because they would be signing off on the chart saying this patient who has preeclampsia should have massage with the students supervised by Michelle today. They're safe to do that. So basically, not stopping is what my strategy has been because education over time, people come around.
Yes.
They
Yes.
see the proof,
Hmm.
the evidence, the body of evidence.
Right. Right. So that's awesome. So, ladies, as you heard, don't stop,
Mhm.
educate, and also advocate.
Advocate.
Yeah.
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 Yeah. Yeah.
Awesome. And so, what do you define as success in the perinatal massage therapy world? And has that definition changed from when you first started in this field to where you are now?
Yeah. When I started in the field and I knew I had a passion for pregnancy, um, but I didn't see more than maybe, 10% of my practice were pregnant patients. I'd be so excited when they'd come in. But their pregnancy would come, begin, and end, and then I wouldn't maybe have one for a while. My definition of success then was, what would it be like if my entire practice was pregnancy, postpartum, infant, and children? Like that would be so amazing. And if when I was teaching, I could focus on pregnancy and teaching other therapists how to do what I do and teaching students who are learning about pregnancy massage. I'm getting emotional saying this because I have never actually said this out loud, but I'm there now.
Awesome.
It's been about 4 or 5 years now where my practice has been exclusively this. In the space that I work at in Durham, I work with pelvic physiotherapists, counselors, people who do fitness around a pelvic floor, just lactation consultants. We're all working with the same community. And so that's who we see, that's who we serve, that's who we empower, that's who we're educating, that's who we're supporting. And it is the best feeling to be here, to have made it to here. So I guess my definition of success didn't change that much. I just realized that I am in that strive now. I'm in that stride of success right now.
Awesome. So I just want to cheer you on, Michelle, that, the vision that you had.
Mhm.
Woo, yeah, the vision that you had, it's being realized.
Oh, thank you so much. Yeah, I had that moment of just realizing that realization while I was talking to you that I think, being a youngster, this is my first career. I went to
Uh-huh.
U of T and I fast tracked my education at U of T and graduated in 3 years, went right into massage. I did a fast track massage program, graduated in 18 months, hit the ground running, and had a job. It was always my dream to have freedom, to have options that I didn't see my parents have.
Mhm.
And 20 years. I'm coming up on my 20-year anniversary as a massage therapist. I'm 43. You know, I was a baby when I entered, and success was just to be able to pay either my rent or mortgage each month. That was what I defined as success at that age, to be able to buy groceries, to pay my bills, and maybe not be worried about that. And then to get to where I am now, where I've been on international stages, I've traveled the world with massage, Africa, India. I've been on various podcasts and shows. I've been on television. I've written a book. I've done so many things that I'm so grateful for that far exceeded, far. I couldn't even have dreamt that I would have been doing the things that I am doing, the things that I've been doing.
This is awesome. This is encouraging me. And ladies who are listening, I hope it's encouraging you that whatever your vision is, it is possible for it to be realized. And as Michelle is actually living it out, that you likewise can do that and live out your success, whatever that success may look like. So, ladies, be encouraged. And it's never too late to start. If you don't feel that you've reached the definition of your success, it's never too late to start, and whenever you do get started, as Michelle said, you can hit the ground running and get running.
That's it. Love that.
Michelle, we can talk for ages, but I want you to share with the ladies how they can connect with you, because I feel that there may be some ladies who may want to connect with you in relation to perinatal massage therapy.
Sure. So on Instagram, you can follow me at Flow Birth and Beyond RMT, as in registered massage therapist. So at Flow Birth and Beyond RMT.
Excellent. Well, this was a very inspiring conversation with Michelle Francis Smith, who is a registered massage therapist. She specializes in perinatal massage therapy. And so we have come to an end. It was great speaking with you, Michelle. Thank you so much for joining us on this Thursday evening.
Thank you, Aisha, for having me. And I'm really just wondering about one thing.
Tell me.
I'm going to be your guest next week.
Next week, we will be having a lady by the name of Joanne Keene, and she is the co founder of Keen Eye Productions. And so stay tuned for another inspiring conversation. And so, ladies, if you haven't subscribed, please subscribe to Rise with Hope. Thanks for joining us this evening. I hope you enjoyed it. I know I certainly did.
So
Michelle, thank you.
thank you.